And I'm also going to stop my video just so it will help in the streaming of the data. So
Sure.
let me take care of that.
That sounds great.
Okay. So first of all, you're familiar with microbiome labs, but I don't know if you know that we now have 16 different products. So if you want to let me know kind of your practice specialty.
Do we carry which ones? Yeah, so and I can't remember if I connected with you years ago. I was the nurse for Dr. Amy Myers when she had her practice for years.
Yes.
And I've been in the functional medicine world for, quite some time, but I just opened my own practice and we have a wellness center and we carry, the Megaspore, Mega IgG, Mega Mucosa, things like that. And I know you guys have a lot more. So that's where I'm just like, sorry, my business partner is texting me. That's where I just like need, my biggest thing is like, for what situations would I recommend the Mega Mucosa over the Mega IgG, and I'd love to hear more about all the products. I love y'all's products and we carry them. So I'm probably not like the newest newbie to it, but there's a lot to learn.
Super. So the foundation is the Total Gut Restoration. And that 3-month program will take 3 Megaspore bottles, 2 Mega Pre, and 1 Mega Mucosa. And you'll find that 80% of your folks will do fine with that, except there's that 20% that may be sensitive to an ingredient in the product, or they're just extremely toxic, or they're extremely dysbiotic, or with a lot of gut damage. So in that case, you need to have some options. And as you had already mentioned, we've got a lot of products, and these are to help you customize for those 20% that may take up 80% of your time. So some options you would have, if someone has a difficulty in titrating the Megaspore, they're getting a lot of any type of GI symptom, gas, bloating, a breakout in the skin, constipation, diarrhea, and the first thing is just to have them slow down the process. What is happening is when you're shifting the microbiome populations, these organisms that have taken up residency, that have become pathogenic, are not wanting to leave. They are not wanting to be evicted. So they start releasing that lipopolysaccharide from their cell wall. And there's about 26 different symptoms that could result from that. So most often, that's the problem, and it's just happening too fast. The individual cannot adjust. So you can keep backing off, open the capsule, divide the dose, and if someone, and there's a percentage of those that cannot tolerate Megaspore at all. And for those folks, we would downstep them to a 1-spore or a 2-spore probiotic so that their immune system can catch up. And the HU58 is the Bacillus subtilis. It is in all 3 of the probiotics. And you can stair-step them from the 1-spore to the 2-spore to the 3-spore. So that's one way to use the different probiotics. The other option that you would use different probiotics is when you have an extreme overgrowth, like a MRSA or a C. diff or an E. coli. In that case, very often you would use all 3 of these probiotics at once. And that's a competitive exclusion where you're forcing out the pathogen. And that protocol would be a 2-2-2. So 2 of the capsules at breakfast, 2 at lunch, and 2 at dinner. It doesn't really matter what order. Generally, people will do Restore Flora at breakfast, Megaspore at lunch, and HU58 at dinner. But again, that's random. It doesn't matter. It's just a matter of get the CFU populations forcing out the pathogens. So that's when you would involve other probiotics. When you would use IgG 2000, very often, if someone is having this die off and you determine it's really a toxicity issue, that they're throwing off a lot of the LPS, and very often you can shut it down with that IgG 2000 because it neutralizes. It'll bind to the LPS, present it to the immune system, and take the burden off the secretory IgA. So in that case, you can, if you've got someone who's extremely toxic, you can pre-treat with the IgG 2000 before you start.
I
If
do
you,
have a question. So with the IgG 2000 and the difference between that and the mega mucosa, like as far as like a calprotectin, tons of inflammation, would I use the mega mucosa? And if someone had a decreased secretory IgA, do you know in those situations which one would be best by chance?
you know, the mega mucosa has a powdered form of the IgG 2000. So you're going to get more bang for your buck with the mega mucosa because it has more ingredients. It's just going to be those folks that the mega mucosa needs a little help that you would add additional IgG 2000. That IgG 2000
Okay.
is a pharmaceutical drug at double the dose. Interogram is the name of that brand. So know that at
Oh yeah.
at 4 capsules, it's the nutraceutical. At 8 capsules, it's the Interogram without the excipients. So you can double up on that when you've got
Okay.
someone with a
And then so
megamucosa.
with the there would oh sorry, it's cutting out.
Yeah, it was just,
So technically I should always go to mega mucosa first versus just IgG as isolated if someone has a decreased secretory IgA or gut healing to do?
yes.
Okay.
And then
Sorry, that sounds good. I think there's a delay.
I'm sorry. You might want to remove um, your picture, your webcam. It might stream a little bit better.
Oh, I didn't even know it's doing that. Okay, stop
Oh,
video.
yeah,
Okay.
there you go. We'll see if that'll help the delay a little bit. The other products are tools in your tool
Okay.
bag. So what we've tried to do is everything that we can do for the entire GI tract from mouth to anus. Where's the inflammation coming? Where is the pH problems coming from? Where's the organisms going to hang out? So we have a very specific omega that has high PRMs that we've quantitated and high not only EPA and DHA, but DPA that we've quantitated. Again, reducing that inflammation, helping the immune system to stop the white noise of inflammation. The immune system will work better if the systemic inflammation is lowered. So we're doing everything we can to do that. The Mega Guard is going to help the upper digestive tract. It has the artichoke that's going to help the bile flow. Bile is very antimicrobial. If you have poor bile flow, you're going to have more SIBO, you're going to have more translocation of these organisms because that pH barrier is down. That's their zip code where they know where to live. So bile helps with that. So this product is really great for that phase 2.5 detoxification. It also helps with H. pylori. It also helps with the kinetics with transit time. And then the Mega Microbalance
Okay.
is
So
a
if
great,
someone had SIBO, would this be, sorry, I don't want to interrupt. I think it's the delay. Would the Mega Guard be a good option for someone in conjunction with treating SIBO or before or after? Do you know?
in conjunction is great, especially if they're already
Okay.
having upper digestive issues, reflux, things that really,
Okay.
they can start it before the total gut restoration to relieve a lot of their upper digestive, but they certainly can do it with the TGR.
Okay.
And then the Microbalance is a fungal, great for mold toxicities, concomitant viruses when your immune system is hindered because of mold or yeast or candida. Very often EBV, HPV, and HSV will move in. So the beet propolis helps with antifungal as well as antiviral, but the undeclinic acid is different in that it pulls the roots, which are the hypha, on the candida and keeps the organism from attaching. And I'll show you a diagram on that because that's why it outperforms other antifungals. Okay. The wheat rescue is great just because we know that wheat is causing inflammation in everyone, but those individuals that are especially sensitive to it have to avoid it. And there's so much hidden wheat and gluten that the enzymes are real important for breaking down those proteins to amino acid chains that are not immunoreactive. So that's what that product does. Megaquinone is actually one of my very favorite products. When Megaspore was first launched, it was launched with only 2 products, and that was Megaquinone. And this is a great product because it's supposed to be fermented in the gut. Vitamin K2 is a bacteria fermented product. And when you don't take enough of the K2, the organisms in your microbiome are going to use up all the K2 because they use it in their mitochondria. It's a quinone, which is in the electron transport chain of the mitochondria. So they're very greedy as far as wanting all of that K2. So you need at least 300 micrograms. You need a stable, natural source. And there's so many clinical symptoms that go back to or relate back to K2 because there's so many receptors in our soft tissue that are K2 dependent. So lowering blood pressures, dissolving kidney stones, anti-aging, all of that's a K2 issue. And then Phytospore came about because everyone's has been asking, can we give Megaspore to our animals? And of course the answer is yes, but we're just, private labeling or specifically labeling different products. And then the last 3 products that have been added to this list are the immune products. And we're excited about that because everyone is interested in the immune system right now. That is your best defense against any invader. So the 3 products are the spray, which is Megacidin, the daily during the season of cold and flu, which is Megamune, and then the antiviral, which is Megavirin. And I'll touch on those, how they trigger several different parts of the immune system for a very effective approach. Okay, so these, as you see, there's a lot of research going on with microbiome labs. All of it spawned from the original study that was done at North Texas in Denton on metabolic endotoxemia. So besides lowering lipopolysaccharide, there were many other indicators that were lowered that make sense when you're actually sealing the gut. And now we're going back doing the independent research on each of those analytes and the different disease conditions. So you'll see all the other microbiomes relate back to the gut, whether it's the skin, the vagina, the eyes, the mouth. Each of those have their own specific concern, but they also relate back to the gut, and that's why you want to have a 2-pronged approach. Treat the gut, treat the acute area microbiome. So we'll have different protocols for those different areas. We talked about when you would use all 3 of the probiotics and when you would use them individually. This slide is just for me to remind myself to point out that our whole approach is very different than other gut companies. We're not looking for the pathogen, designing a search and destroy protocol, and then dropping an A-bomb in the gut to remove that pathogen. We're more concerned about the collateral damage of what happens with the microbiome and how the community works together. And we know the power of these spores. They have an intelligent modulation. They are the ones that should be introduced first into the environment in order to decide who are the good guys, who are the bad guys, and they do that through quorum sensing, which is a chemical surveillance system that they can detect even before they come out of their spore stage, who's in the environment, how many are in the environment, and what specific species. So they can actually customize an antibiotic to a specific pathogen, come out of the spore stage, locked and loaded, to sniper that pathogen. So with that kind of intelligence, we can't compete. We can't second guess what we should do to someone's gut, to their microbiome. We need to put in that SEAL team to go in and decide first who should stay and who should go. So our whole approach is, based on healing and sealing the gut. And we do that in 3 stages. First, the mucin 1 stage, which is where Megaspore shines. It helps with the diversity. It helps jumpstart keystone strains. And like I said, it'll sniper certain pathogens that it knows is harmful. The second is to feed those keystone strains. The long-term protection of the gut is up to the keystone strains. It's not staying on a gut protocol for the rest of your life. It's helping the good guys who eventually will take over and keep out the bad guys and keep the integrity of the gut good. So that second stage, that's that prebiotic, and that's why that's so important. And we've done a synergistic study to show that it does do that job. And then the third area is the mucin 2, which is the job of the megamucosa, to keep that thick gelatinous coating, that mucin 2, intact, because it's the job of mucin 2 to protect the microvilli, protect this tight junctions, and protect the underlying immune system. Without it, as you can see, this lipopolysaccharide is going to degrade or eat into the mucin 2. It's going to breach the barrier. It's going to destroy the tight junctions, the pathogens, the lipopolysaccharide, undigested food. All of this is going to flood into the lumen of the cell. It's going to activate the immune system. You know, the cascade of cytokines and interleukins are going to go crazy. And you've got raging inflammation. And it's this underlying systemic inflammation that is white noise to our immune system. And then when we are invaded by a bacteria or a virus, our immune system can't respond quickly enough. So that's why we've got to get down the inflammation in the gut and then help promote the immune system to do its job faster and more effectively. So these are just the summary points of what we're trying to do in a healthy gut. Increase diversity, lower pathogens and toxins, repair that mucus barrier, improve those tight junctions, and lower inflammation. The gut is damaged because of all of these reasons. And as a practitioner, that's where you're designing a new lifestyle for your client. You're helping them find out how this problem started in the first place, help them heal and seal their gut, and then make sure that this doesn't happen again. So this will apply and be customized depending on your client. These are all the reasons Megaspore and our probiotics are different. And I know you already know these. You're going to get questions from your clients. You know, why aren't my Walmart probiotics just as good? Why can't I take lactobacillus and bifidobacteria and increase the ones in my gut? And it's because that window of opportunity closed when they were 2.5 years old. You cannot reseed or replace a microbiome. You can only encourage the good guys and sniper or discourage the bad guys. Now that SEAL team that I mentioned before, the 5 spores of Megaspore each do something different. So that's why even if someone is sensitive because they've got a damaged immune system, they have a damaged gut, and you have to start them just on the Bacillus subtilis, you want to work them up to more and more of these spores because each one adds a different benefit. So the Restore Flora with the Bacillus clausii is going to give them, you know, more immune protection, more stimulation, and then moving them on to Megaspore is going to give them all of these other advantages. So, you know, that is our end goal. And this is that foundational study that I talked about before. It was done in August of 2017. This is what put Microbiome Labs on the map and totally turned the probiotic industry on its head, because you've got to be able to show a significant difference in the underlying condition that spawns all the other chronic illnesses, and that's metabolic endotoxemia, and that's being able to reduce that lipopolysaccharide, and that's what we showed in 30 days, a significant 42% reduction in the spore-treated group. And remember, this is a college student group of participants that had no symptoms. So what we found in the placebo group, that their lipopolysaccharide was steadily increasing. So not only did we discover how effective the spores are to reducing leaky gut, we also saw that those that don't get exposure to spores are at risk for underlying chronic gut problems that's probably starting in the early ages when they leave home. So that was a significant discovery. That overall change that you can impact in these individuals' life is over 60%. And then from that study, it makes sense that if you're really healing and sealing the gut, then all of those indicators should improve. All of the chronic illness and inflammatory symptoms or conditions should improve as well. So now we're going back and doing additional research on those analytes and the specific conditions like irritable bowel. And the results are proving out that yes, Megaspore demonstrates the most profound improvement in the IBS severity score. The Megaspore subjects reported better general health and physical functioning overall. And that's what we would expect to see. Another study on an acetaminophen-induced acute liver failure. So not only is it helping inflammation in the gut, because the liver and the gut work hand in hand in reducing toxins, if you have liver failure, then it's good to know that Megaspore is going to help with that because it reduces ammonia, it reduces inflammation, it increases glutathione. It's been shown to be as effective as milk thistle. So this is important to know as for your hepatic encephalopathy or your liver failure conditions as well. This is a study with just
Interesting. Didn't know.
Yes, I mean it's mind-blowing when we look at all the research that really has not been well presented in the probiotic world on how these work. And this one is just on the HU58 itself, the Bacillus subtilis, and how effective it is reducing the cytokines and interleukins. IL-6, for instance, reduced by 45%, TNF-alpha reduced by 55%. So it makes sense that you would start with these spores first in your gut protocols and your liver protocols. The Restore Flora is great. Say you don't have time to titrate someone up on Megaspore and find out how well they can tolerate it, and they tell you, oh, and by the way, I'm on antibiotics. You do not have to stop probiotics when you take antibiotics. These spores are smart enough to go back into the spore stage, protect themselves, wait for the antibiotic to pass, and then be right there at the cellular level to start cleaning up the mess. So this is a great option so that you reduce any side effects of the probiotics as well as any potential die-off. And here's that Mega Pre. The first thing you have to do is explain away that the FDA, even though they tell us we have to put contains corn and milk on the label, it does not contain corn and milk. Corn and milk is a food. It this product does not have any proteins in it. It's strictly oligosaccharides, so there's no immunogenic effect. So that, unfortunately, you have to explain to your patients, but the effect is amazing. We know that Megaspore will jumpstart these keystone strains by 20%, but the Mega Pre is going to jumpstart them by 80%. So that's a huge difference when we realize that it's those keystone strains that are going to be the long-term guardians of the gut. And so that we wanted to show in a study how effective it is. The Mega Mucosa, as we mentioned, it's key ingredient.
When would you do the prebiotic and the probiotic?
You start with the probiotic, titrating it up the first month, and then you introduce the prebiotic the second month of the 3-month program, and then the Mega Pre the 3rd month of that program.
Okay.
And again, we're introducing spores first because they're the marshals and the intelligent modulators. The prebiotic is going to grow up those keystone strains that the prebiotic jump-started, and the Mega Mucosa is going to seal the deal because it seals the gut. The 3 primary ingredients of Mega Mucosa is that IgG because of that immunoglobulin ability to neutralize pathogens, viruses, bacteria, and very importantly, that lipopolysaccharide. And this is just showing the mechanism of how immunoglobulins work. And it's going to take a great load off of your secretory IgA in your gut. And that's why, introducing that mega mucosa is going to start that. If you need additional support, you have it in a capsule form. These are all the studies that have been done on mega IgG 2000. So we know that it attaches, binds, and what the mechanisms are for reducing these antigens. The other two ingredients of this product are important. The amino acids help increase that mucin 2, specifically the citrus polyphenols stop the oxidative stress of the immune cascade. It also increases short chain fatty acids and helps with microbial diversity. This study is why we chose these 3 amino acids, the threonine, the serine, proline, and cysteine, because they specifically increase colonic mucin synthesis by 95%. And many times the question at this point is, why not L-glutamine? And you'll notice we don't include L-glutamine in our formula. And we know because of dysbiosis has the ability to unconjugate hormones, bile salts, and certain amino acids. And their metabolites can sometimes be toxic. We don't want to take that chance. L-glutamine can be converted to glutamate as an excitatory neurotransmitter of the brain, so we don't take that chance. We make sure we use ones that very specifically work for increasing mucin. This just reminds us, again, that point where the barrier is breached, where all of those toxins, food particles, pathogens are flooding into the lumen of the cell, is the point that is triggering all inflammatory diseases, autoimmune diseases, and systemic infection. Just emphasizing how important it is to stop that from happening. And here's that point right here. Mm-hmm. Okay, so we've talked about the quorum sensing and all the benefits of the prebiotic for the first month of the program, the prebiotic starting in the second month of the program, and then the megamucosa in the third. So that is the total gut restoration, really the foundation for all inflammatory conditions. And then we're looking for those individuals that have additional issues, or that issues that may have been masked and may pop up while you're changing and you're shifting the microbiome itself. And that MegaGuard, here are the ingredients. Again, the artichoke is specifically helping the bile flow. The licorice, this is a high bioflavonoid that specifically stops the protein synthesis of H. pylori. And then the ginger root for the transit time of both the stomach and the upper intestinal tract. And then the rest here is just showing each one is researched independently and registered independently. The fish oil is specific in that it actually quantitates the pre-resolving mediators, which are those molecules that reduce inflammation. And we focused on this. We're the first fish oil company to specifically quantitate them, as well as quantitating the DPA. Because most people take fish oils, let's give them one we know works. The rest here is just all of the bells and whistles necessary to introduce a high quality fish oil to the market. The Mega Microbalance, I promised to show you this diagram, which I think really illustrates well how this product works. This hypha works like roots, digging into the epithelial cells, increasing that permeability of the metabolic endotoxemia. The undeclinic acid stops this hypha formation, so it can't put down roots. So where other antifungals may mow the lawn, it always comes back. If it can't attach, it's washed out of the system. So that's the real key in how that product works. Wheat Rescue, again, you've got it. This is Tom O'Brien's most advanced anti-gluten, anti-gliadin formula. So you've seen in other companies, he's had 1 or 2 of these enzymes. This one has the most, as well as our spores, to help with that intelligent modulation. So this is a very effective enzyme formula specifically targeted at the gluten and gliadin. And then this here, just again, bells and whistles to show its research and how effective it is. Okay, now megaquinone. This, again, one of my favorite products because of this slide here. There are K2 receptors in the pancreas, the brain, the muscle, adipose tissue, and in our sex glands. And the reason this works so well with that is because calcium deposition on beta cells will stop insulin synthesis. And you can reverse that with K2 because it removes the calcium deposits and puts it back into the bone. Same with neurological disorders, Parkinson's, tics, dementia. Many of that is because of calcium deposition. Same with muscles, muscle cramps, low insulin sensitivity, so low muscle energy in the mitochondria. Again, vitamin K2 is a quinone. It helps with mitochondria and electron transport. It helps with mobilizing calcium out of that soft tissue. Same with the adipose tissue. It's a fat-burning, mitochondria-enhancing formula. And the testes, it's very interesting. It'll help with infertility, not only in testosterone production, but also in sperm motility. So that's, there's a lot of research out there on vitamin K2. So we really had to search for an area that was not well researched. So we chose this area and published the paper on cardiac output and blood volume. And this is highly significant because even just a few percentage is big when you talk about athletic edge and performance. We showed a 12.5% increase in cardiac output with vitamin K2. So this is great, not only for athletes though, but also for the elderly. This way they'll get more out of their exercise and reduce calcium depositions throughout their body. And this is showing the difference between our megaquinone formula and our K2. The difference is megaquinone has more absorbing minerals in it and some K1 because the body spares K1. If you're deficient in K1, your body will convert K2 to K1. So this is a great product to start individuals on for about 3 months until their nutrient buckets are full. And then I would switch them to just the MileMax, which has just the K2 in it. And that way they're not doubling up when you've got them in other formulas that have magnesium and zinc in there. So that's the way I would use it, and it's real effective that way. Phytospore, we mentioned again, everyone has their furry friends that have leaky gut as well. So it's a great, add-on, for your patients because many times they'll worry more about their animals than themselves. The megacidin, this is what we talked about. It's a combination of biocidin, which I'm sure you're familiar with, a great herbal blend, and our spores. Yes. And it's designed to use as a frontline approach with, let me get to my picture here. Oh, this one doesn't have picture, sorry. But the mouth, if you don't have a good defense going on in the mouth, then all of your gut protocols might be wasted because you could be ingesting, you could be multiplying bacteria and viruses in your teeth or your mouth or being exposed, and that then can affect the immune system in the gut. So this way you're affecting the B defensin, which is that sniper that the spores can take care of in the gut. And then you've got the great biocidin study that shows you can increase secretory IgA in your oral cavity by 66% in 10 minutes. That's why this works well as a spray when before you go on a flight, before you go into a meeting. It's going to be a lot more effective than a mask. Then the Megamune, which is here, this is your daily immune support, when you're going into flu and cold season, so that you can prime your immune system for the assault. And then the Megaviron is first signs. If you actually did contract a virus or even a bacterial infection, you want to prime those immune, the adaptive system in order to deal with an actual infection. So we've looked at the immune system and how to most effectively make it optimally performing. And we've got to take in consideration the physical barriers, which we're dealing with the immunoglobulins on the malt, the galt, the nalt, and the balt, which are we're talking the bronchial, the nasal, the mucal, and the gut. And we're looking at the innate, which is the inflammatory reaction, and the adaptive, which is the anti-inflammatory. So you need to have different herbs and different spores to deal with each of these three considerations. So that's what we've done in priming the macrophages and dendritic cells in that transition phase of the innate to the adaptive in these combinations. So we know that these specific herbs are going to have a different role in each of those three areas, herbs or minerals. So what we call it is a triple action formula. So it's intelligently formulated to help the immune system in a functional readiness. And it's at therapeutic dosages, and that's very important. It's helping improve the immune surveillance system. Those cytokines and interleukins and toll receptors that need to be attached to the dendritic cells so that they'll be recognized by the immune system. And then we're removing the distractions using the spores. Again, by removing that white noise with the systemic inflammation in the gut, the immune system is going to be able to see or surveil what's going on with the dendritic cells. And then the megavirin, same thing. It's specifically targeted toward viruses by helping the viruses be recognized by the immune system. So it's improving the macrophage interferon production, it's reducing the inflammatory cytokine production, it's preventing viral entry into cells, and it's helping to break down viral envelopes. So it's also part of that triple action. It's focused on the surveillance system, cleaning up cellular debris, removing that white noise, and calming or quieting the immune response in the adaptive immune system. And these are the registered and therapeutic dosed herbs that are in the different formulas.
Okay.
The Megamune is designed to be a daily use, 3 capsules per day with or without food. The Megaviron is designed at first signs of symptoms for just 15 days at high dose. It would apply at this period of time. I would say everyone is at risk because of the stress that we're all going through, but there's other very specific times you'd want to use it when you're traveling or you're around people that do have a flu or a cold. And in a nutshell, that is the entire product line. So I will put my
Love it.
video back on so I can see your facial expression.
I'll put mine back on. Yes, no, y'all had a lot more than I obviously knew about.
Yes, it's one of those exponential growth companies, and you might have known, Taylor, I was with Zymogen in its
I was with y'all when y'all just had Megaspore.
Yes, yes. So you've seen us grow. The only other time I've seen this happen was when I was with Zymogen. So I know there's the pitfalls of being a fast-growing company. Because sometimes they're like a toddler falling all over themselves, but there's this huge excitement that they've got founders that are, Kieran and Tom are really smart, they're really caring, and they're really trying. So, we've got that going for us.
I love it. Well, that was super informative. And I think, I've definitely heard a lot about the products. I didn't even know about the megacidin because I love biocidin and everything. It's a hot topic right now. But my biggest thing too is and I do have people like probiotic rich foods, red polyphenols to help protect that mucosal barrier. But I do think that it would be valuable because I'm at my wellness center, we have the Megaspore, we have the IgG, we have the Mega Mucosa, but just I definitely think we need the prebiotic. but I do think that it is just helpful knowing when and how to use, because I'm like, I do the 5-hour gut protocol, I do stool testing, you know what I mean? Like I've been doing this for a long time, but I think that does help hearing kind of the different phases and the differences. And that's interesting. I'm just like, maybe a spore base isn't for everybody. But you're right. Like usually there's pathogenic bacteria that's causing the die-off or whatever the symptoms with the megaspore. So that was really helpful about the other probiotics, but I don't think I have any questions.
If
How
you
does
do,
as far as like the prebiotics, so would you, oh, what?
well, just to say, if you do stool testing, you should look at our BioFX test, just because it is the whole
I know, I
genomic
heard y'all have
sequencing.
that.
Yeah, so we're seeing, a lot more,
So cool.
yeah, how the community of organisms work together, what metabolites they produce. And since it's whole genomic sequencing, we know the accuracy is 99% versus PCR, which is what the other companies use at 16S, is only about 30% effective getting down to the strain level. So it is going to be it's the only one that the researchers, the pharmaceutical companies, and the government agencies use, because it is state of the art.
Yeah, no, I will look into that. And then if you could just send me this recording so I can share it with my business partner, might have to get my hands on some of that prebiotic, because I
Yes.
definitely, I think that's so important. I don't think people need to be on probiotics forever. I think they need to get rid of the pathogens, rebuild the gut, but also so many people forget about the prebiotic aspect. So, and then how long are people on mega mucosa, would you say?
80% will just do that 1 month in the 3rd month of the total gut restoration,
Okay.
and they're good. Maintenance
Yeah.
is just the spores. You can do megaspore just on the weekends, just to keep the colonies alive.
Okay.
But, once you've healed and sealed the gut,
Okay.
you're good to go, unless you, get assaulted again. If you get, exposed to something, or, something tragic happens.
Yeah. Or never got rid of that pathogen.
Right. And to let you know, the Mega
Sure.
3
Well,
also
this
comes,
was so helpful. Thank you so much for your time. Yeah.
the Mega Pre also comes in capsules. So you've got an option there, either as a powder or as a capsule.
Oh, good. Awesome. Well, thank you so much, Tracy. I really, really appreciate your time. That was super helpful. Thank you so much.
You're welcome. I'll send you the recording. Please reach out anytime. I love talking about microbiome.
I will. Me too. Gut health is everything.
Yes,
Thank
yes.
you so much.
You're welcome. Thank you. Take care.
Okay, bye.
Merry Christmas.